Hello and welcome to the COVID-19 pandemic update. I'm Kayode Okikelu. First, the highlights. Now that the Omicron variant has been detected in Nigeria, the NCDC races to track down possible contact as it prioritizes genomic sequencing and intensifies public health measures. The federal government enforces vaccination or negative test results for civil servants to access public offices. South Africa President Cyril Ramaphosa visits President Buhari, calls for Omicron travel ban to be lifted. Well, it was always a matter of when and not if. As it stands now, the Omicron variant has been officially detected here in Nigeria. 3 cases, in fact, from travelers with a history of travel to South Africa. Well, the NCDC says it is following up to ensure isolation and contact tracing, while arrangements are also being made to notify the country where travel originated from in line with international health regulations. It's very likely that the Omicron infections might increase here in Nigeria, but our response should not be panic, but vigilance. We're not helpless against the virus after all, so let's go back to the basics by using the proven safety measures such as wearing of face masks, regular hand washing, physical distancing, and of course, the extra layer of protection, vaccination. Well, we have quite a package for you today on the program, but first we take a look at the latest COVID-19 figures. Don't forget, we're still dealing with the Delta variant, which is responsible for a majority of the infections globally.
A 105 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT, indicating an increase from the figures reported earlier. Lagos logged the highest infections with 43 cases, Gombe had 21, FCT had 16, while Niger registered 10 cases. Rivers recorded 6 cases, Plateau had 5, Edo had 2, while Bauchi and Kano had 1 case each. The new tally has increased the total confirmed cases in Nigeria to 214,218. 12 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 207,304. 1 additional death from COVID-19 complications was reported in the last 24 hours, raising the fatality toll to 2,977. More than 6.5 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 3.5 million persons have been fully vaccinated. In Africa, there are more than 8.6 million confirmed cases and over 222,000 deaths recorded across countries on the continent. The total global confirmed cases have surpassed 262 million, while deaths are beyond 5.2 million.
Meanwhile, unvaccinated federal civil servants are experiencing a tough time accessing their offices as the government commences its implementation of strict COVID-19 protocol. As early as 7 a.m. today, security men manned the main entrance to the Federal Secretariat, where they demanded either a vaccination card or evidence of negative PCR tests before allowing the employees to get access into the Secretariat. Well, some of the civil servants questioned the decision by the Presidential Steering Committee, saying that COVID-19 vaccination should not be made compulsory, but a matter of choice. And for others, getting the vaccine is still a challenge, even though they are willing to get vaccinated.
Gates shut, security men on guard. Access to the Federal Secretariat Abuja is being restricted. Many of these civil servants behind me are not able to access their offices because they do not have evidence of a COVID-19 vaccination or a negative PCR COVID-19 test. Only those that fulfill the requirements are allowed access, while those who fail to meet up are restricted.
We are not sending them back to their houses. We are sending back to the various vaccination centers in their own interest and in the interest of others.
This enforcement exercise comes exactly 49 days after the Presidential Steering Committee on COVID-19 announced that only those with COVID-19 vaccination card or evidence of a negative PCR COVID-19 test done within 72 hours would be allowed access into public offices. However, some civil servants have their reservations over the decision.
Is it a must that we must take this? Even in other countries, do they force people to take it? I don't think.
It should be about choice. It should be about willingness to do it and not a force.
I was at the clinic yesterday to take it. The clinic people say that the code on the card has finished, that we should go and come this morning.
For some, there's a need to create more awareness.
Not that people don't like to take it. People want to take it. Let government calm down and educate people more and see the better way of doing it.
Meanwhile, about 300 meters away from the secretariat, a COVID-19 vaccination exercise is taking place, and some civil servants are taking advantage of it.
Some persons complain of having fever and all that after taking the vaccine. I wasn't prepared for all of that. That's why I've not taken it. But now that it's compulsory, I'm submitting myself to take the vaccine now. After
about 2 hours, the enforcement exercise at the phase 2 of the Federal Secretariat appears to have been relaxed and access unrestricted. Many will say it's the first day, so we hope to see what the days ahead look like. Meanwhile, Nigeria has confirmed first cases of Omicron variant, making it more imperative for the government to enforce stricter measures. Emperor Simon, Channels Television News.
Well, the confirmation of the Omicron variant in Nigeria coincided with the visit of the South African President, Cyril Ramaphosa. Now, although the visit was mainly to improve bilateral relations between both countries in the areas of trade, youth development and arts, the South African President was grateful to Nigeria and indeed to President Buhari for showing solidarity at a time when other countries are imposing travel bans. Describing the restriction as discriminatory, he again called for a lifting of the bans imposed on South Africa and other sister countries. And he said that this should be done to avert long-lasting damage to the economies affected by this ban. Meanwhile, President Buhari has described the visit of President Ramaphosa as successful in spite of the scare of a new Omicron COVID-19 variant.
Despite the scare generated by the new coronavirus variant, we have been able to hold successful meetings while observing strict coronavirus protocols through fraternal cooperation and understanding.
As African countries, we are standing united against the imposition of arbitrary and discriminatory restrictions that are not only unscientific, but counterproductive in the long run.
So we're joined on the program by virologist and chairman expert review committee on COVID-19, Professor Oyewale Tomori. He joins us live from Ibadan, the Oyo State capital, via Zoom this evening. Well, Prof, I'm glad we're able to finish our conversation from yesterday, but then some things have changed since we spoke, one of which is the official discovery of the Omicron variant in Nigeria. We'll talk about that, but I recall we also spoke about the visit of a South African president and what you expected Nigerian government to do. So seeing that this visit has happened, what are your reactions?
Yeah, I mean, the governments have decided. It doesn't mean that they are right in their decision. That's number one. But for me, what I will look forward to is that day two, after the arrival of this team, they are tested like the normal protocol is. And I pray none of them is positive. If any of them is positive, then we begin to see the problem of reason why we're saying they should not come.
Well, so to the Omicron variants, the NCDC had first referenced retrospective sequencing of samples collected in October in an earlier statement which was released today. But then that was said to be an error. And it said, I mean, they were referring to the Delta variant. So some sort of, back and forth here and there. But the NCDC says they have started contact tracing, isolating the travelers, try to get them access to care and all of that. So seeing this, I mean, some of these responses, would you say we're in a good place to get a handle on this Omicron variant?
I think, well, now they've started, but you see, even before this came, remember we talked about this yesterday. We knew from the report that came out from the Canadian side that Nigerians who left here, tested positive over there. That was when we should have started. We should have gotten in touch, just like you are informed other countries. We should have gotten in touch with the Canadian government, traced all those families. The contact tracing would have started from that time, when we knew those 2 people were positive, or 3 or 4 of them that got into Canada. I was asking some of the people, say, well, we don't know how to travel. Whenever you travel, it takes you less than 24 hours to get to any part of the world today. So the fact that we knew that was when we should have started our contact tracing, not now. We should have gotten information from the people. Where did these people come from? When did they leave Nigeria? And those other things. Then we can begin the contact tracing. The day before, they said, oh, so far there's no evidence of Omicron. Then the following day, we had this information, and we now had 2. For example, we don't know, we need more information. When did they come in? What dates did they come in? Those are the kind of things we're doing. Where have they been since they came in? Have they been in isolation before you tested them? How soon after they came did you test them? These are points that I think this is what requires minutest detail, paying attention to the minutest details. And that's the only way that can save you. That's what is called preparation. The other things they're talking about, panic, that's not the thing. When you go into this type of situation, that is what we call precautionary method, taking every aspect, looking at all the details in particular. Where did this person come from? Where did he travel from? What time? And who has he been meeting? If he was in self-isolation, did he maintain self-isolation? How many people has he contacted since he arrived? These are the issues that we're raising, that we need to pay more attention to this issue.
So the coming days clearly will be critical for Nigeria in getting a handle on this. So one of the points we need to reiterate time and again, and I think the NCDC has spoken about that, is surveillance through testing and sequencing. But we're not making a headway in terms of testing, really, because a large number of people that test are perhaps travelers or people who can afford to pay for testing. Whereas in other countries, you've seen governments giving out rapid tests for free. They call them lateral flow kits and the rest, so they can better monitor this. So is that hard to do here, so we can sort of know where we are?
You touched the point, and we've been saying it. We cannot be depending only on those who are sick, who are then going to test, or those who are traveling out, who are then going to test. But given the nature of our country, a lot of those people who get out, travel out of the country, they go out with fake results, and they are being tested, found positive when they get into those countries. So we need to do like other people are doing. It's not just contact tracing of those people. We need to go beyond those who are sick. You remember, 60 to 80% of these people are not asymptomatic. So we don't know whether they have it. So we need to go into the community testing so that we know exactly the depth of the problem we have. We need to monitor, analyze the data we're getting. How much of those who are traveling out, how many of them are positive? What information are we getting from those who are coming in? Are we analyzing them? Are we seeing a rise? Are we seeing a drop? These are things that we need to constantly monitor and use to plan where we are going. Waiting for 4 days, 10 days after the person has come in. How many are you going to take to a contact of somebody who came into the country a week ago? How many people does he remember he has seen? But if you handle the thing day 1, day 2, then you know his contacts. These are the things that other countries are doing. You mentioned countries are giving new testing methods. You can test yourself and then be able to know. So when you're positive, report to your country. That is the direction for us to go.
And another point, another direction that we've tried to tow is a path of vaccination. So we've had series of reports from people who have been turned back at vaccination centers. In fact, the reports we showed earlier referenced people who said they went for vaccinations, but they were turned back for lack of vaccines, some for lack of codes. And this is coming after the government actually said we have so much vaccines that what we need are just arms of people to be jabbed. And it raises a concern why we seem to be dropping the ball in these critical areas. But we'll go to break quickly, Prof, and we'll get you to respond to this. I mean, why do we seem to have a disconnect between we have a lot of vaccines, but people visit those centers and they don't get vaccinated? And some other issues we'll touch on in a moment. But please stay with us, Prof. We'll be back. You're welcome back. So let's continue our conversation with Professor Oyewale Tomori, virologist and the chair of the Expert Review Committee on COVID-19. So I was talking about vaccination. So we have the government, the PSC saying we have millions of vaccines, and you see people trooping out to vaccination centers, and what they hear is, sorry, we don't have vaccines available. Come back in 2 weeks' time. Sorry, we don't have the codes. And these are people who got their first jabs. And recall that government said if you've got your first jab, then at least you're sure you have a second dose because it's been kept. Why do you think there's a disconnect, really?
I think it's the same thing that's happened to us in Nigeria. Lack of planning, consistency in the things we do, seriousness in what affects our life. A lot of the errors and things they are finding, you can give us of excuse you like. We shouldn't be giving excuse now. How long have we been vaccinating people? How long will it take for vaccines not to be at the vaccination site? Those are the things we should begin to look at. How do you as an individual perform when you're given an assignment to do? How did the boss monitor those people? Those are the reasons we're getting what we're getting. There's absolutely no reason why any station in this country should, at this time, have no vaccine if we say we have the vaccine to give to people. And you remember they are focusing mainly on government workers. At this time, by now, I mean, everybody should have been, in fact, first of all, to those people who are waiting until today to get jab, I blame them. I don't blame the government for that one. That's their fault. They were given enough time to get the vaccine. You may say they went there, they didn't get, but they should have complained. Secondly, let me also make one point. The fact that somebody gets vaccinated today at the secretariat, it still doesn't make him fit to go to work because immunity does not develop until about 10 days to 24, on about 10 to 14 days. So the fact that you got the vaccination today does not give you the license to go to and work in the office. Go and wait until you develop your immunity or you get your second dose. So these are some of the complications of what we're doing when you don't plan properly.
Oh, quite interesting contradictions there. But so let's try to project into the future. If indeed this Omicron variant is potentially as dangerous as perhaps the Delta variant or more, how long till we start seeing a spike? I mean, there are fears of a fourth wave. We're not sure if the Delta variant will be responsible for the fourth wave or the Omicron variant. But how long till we start seeing a spike if indeed this is really dangerous?
First, it's a bit difficult to predict time. It depends on human behavior. If our people go back to wearing their masks and keeping it safe distances, avoiding these large gatherings, I'm sure we can strengthen it out. This peak may not be as high as it is, but it depends on human behavior. The virus is already here. The fact that we're detecting it now does not mean that it arrived today. I mean, if you go and look at the story about COVID vaccine, you remember South Africa being the one reporting it. There was a report in the newspaper today that they found the Omicron in Netherlands in November 19 or something. And then they said, oh, Africa reported. The point is that Africa reported on the 24th. It does not mean that was the day they found it. Go and check the records. Way back, as far back as November 1918, even November 11, Botswana had already reported a case of people, diplomats, who traveled supposedly, as we said, from West Africa. So let's face the situation on hand. We don't know what it's going to be. It depends on us as individuals, you and I, making sure that all those people who have abandoned masks, please go back and wear your mask. We don't know what the Omicron is going to behave like. Nobody knows. We're still watching. It may mild, it may be serious. So please wear your mask, and that will determine whether this fourth wave will be high wave or no wave at all.
So it's literally in our hands. We'd like to thank you so much, Professor Oyewale Tomori, virologist and chairman of the Expert Review Committee on COVID-19. It's always a pleasure to tap into your wealth of knowledge. Thank you so much.
Thank you very much, Cardi. It's my pleasure.
Well, over to the U.S. now, where it's a day to the announcement of a detailed strategy to fight COVID-19 in the winter, as President Joe Biden rolls out lockdowns or shutdowns amid fears over the Omicron variant. Well, travel restrictions have already been placed on southern African countries, a move which is expected to help in reducing the spread of the virus, but not without a heavy burden on lives and livelihoods. Now, although the U.S. has not recorded the new variant just yet, neighboring Canada has detected at least 5 cases from individuals who are said to have recently traveled to Nigeria. So consequently, Canada says it will deny entry to foreigners who have been to Egypt, Nigeria, and Malawi within the past 14 days. Let's now join our Washington correspondent, Maria Bird, who joins us for more on this. Maria, it's good to have you. Well, we really tried to have you yesterday, but thankfully we have you today. So let's begin from where we picked up, where we stopped last time. This time last year, we remember the United States having over 160,000 cases, and well, that has tapered down recently. But generally, what's the situation regarding COVID in the U.S.?
Thank you for having me. Glad to be with you today. And so you're exactly correct. A year ago, we were in the midst of a major crisis as it relates to the pandemic. We are now in a much better place. We're now reopened. Most places are even at a point where they are able to reduce some of their mask mandates. But we do know the winter is looming, and we have seen an increase in cases across the country. The new variant has not yet reached the U.S., but again, the administration, the White House, President Biden is very watchful of the situation and putting parameters in place to potentially put some more restrictions so that we can ensure that that new variant does not come in at a very vulnerable time for Americans, the winter season. But children are now able to be vaccinated all the way to the age of 5 and up. And so that means we're having greater herd immunity in the United States, which will then obviously assist with reducing the impact of COVID-19 here in the U.S.
But for people generally, has there been any sort of change in their attitude to the MPIs, perhaps the vaccination as well, with this news of the Omicron variant? Has anything really changed? Have you noticed any change?
Well, what we've seen, obviously many people were concerned when early November, just a little over 30 days ago, the vaccine was available for children 5 and up. And when that happened, you saw many adults, many parents a bit concerned about giving this vaccine to such young children. But obviously with the news of the new variant, you began to see in the last week to 2 weeks, many individuals are eager to get whether or not it's their booster shot, whether or not it is their first vaccine, and definitely getting the children vaccinated who are within the schools in tight confines with large numbers of individuals.
So, Maria, on a final note, this new variant changes the optics on COVID-19. We've seen restrictions. I referenced the one from Canada, US, and a lot of other countries, in fact, affecting Nigeria. And a lot of people are saying, well, in fact, the WHO, for one, is saying, maybe this is not the way to go. They're saying this might be discriminatory and all. But to be fair, and I'm putting you on the spot here, what would have been perhaps the appropriate response from these countries?
You're exactly correct. We are expecting to hear some of that coming down the pike, and it is very clear that some of this could be teetering on the areas of a bias nature, and that is something I think that many in the U.S. are hopeful that does not become something that is a biased nature, and that we are able to really address it at the root of what it should be, which is a health crisis and a health issue that needs to be tackled in the best way possible. We do know that the U.S. is obviously putting even parameters around Americans that are re-entering the U.S. and potentially having them to come in before coming back home, obviously having a COVID test, but even upon arrival back in the U.S. having a COVID test. And so I think that some of these issues have been brought forth, and hopefully there will be some right sizing, and that there will be an insurance that this is really about the best health for everyone across the globe, and then this is not something that it becomes restrictive and biased in nature.
Well, always great to see you, Maria, our Washington correspondent, Maria Bird, giving us the latest update from the U.S. Thank you so much.
Thank you.
Well, we have more updates for you on the global scene. Here's our COVID-19 global update.
Apart from Nigeria, a number of countries around the world have also reported their first cases of Omicron today. It includes Ghana, the Republic of Ireland, and Brazil. Saudi Arabia has also reported a case. It's the first Omicron variant case reported in the Gulf region. Canada, seeking to halt the spread of the Omicron coronavirus variant, will now require people arriving by air from all nations except the United States to take a COVID-19 test. Canada has identified 7 people with the new variant, at least 4 of them whom they say were recently in Nigeria.
The rules around those that are not vaccinated are not changing today. No, it's the same rules apply. when someone comes into Canada with a right of entry, that person needs to be tested at the land or at the airport, and that person needs to quarantine for 14 days and need to be tested once more on day 8. What changes today is the rule for those that are vaccinated coming into an airport in Canada. Those people will need to be tested on arrival at the airport and wait, and isolate and wait until their test result is known before exiting their isolation period.
Meanwhile, Europe continues to battle rising COVID cases as travel bans and new measures take effect to slow the spread of Omicron. In Portugal, proof of a negative COVID test is now required for anyone over the age of 12 arriving at the country's airport, whether or not they have been vaccinated. Portugal has already reported more than a dozen cases of the new Omicron variant. In France, travellers from outside the European Union will be subject to the obligation of a negative COVID-19 test, regardless of their vaccination status. Away from Europe, in India, officials have made on-arrival COVID-19 testing mandatory for flyers from more than a dozen countries, including South Africa and Britain. The decision comes after a man who recently returned from South Africa tested positive for COVID-19, though it is not yet clear which strain of the coronavirus he contracted.
Do visit our website, channelstv.com, for more updates and a better understanding of the pandemic, plus other stories, all at your fingertips. You see this, the latest one, and the Omicron variant in Nigeria, which has also been confirmed in Ghana, as well as other countries. So for the latest, do visit channelstv.com. And that's the COVID-19 update. Thank you for watching. I'm Kayode Okikilu. Goodbye, and please stay safe.